So good morning all. Presenting the paper on choroidal vascularity indices and coexisting morphological changes in polypoidal choroidal vasculopathy, a comparative analysis between two treatment strategies. Choroid, the outer vascular coating of the eye, has the highest blood flow of any tissue in the body and it plays a predominant role in the ocular health. Choroid has been implicated in the pathogenesis of many intraocular diseases such as AMD, myopic macular degeneration and pachychoroid disease spectrum. So unlike the retina, which has a consistent pattern, evaluating the morphometry of the choroid is challenging because of its complex and variable architecture. So it can be thin or extremely thick choroid. So morphological and vascular analysis of the choroid have been revolutionized with the advent of the enhanced depth imaging, which makes better delineation of the choroid. So the three landmark trials, Everest, Laptop and Fujifilm, have established the role of combination therapy of PDT with anti-VEGF in initiating therapy for PCV. But in developing countries, the cost always remains a hindrance and many patients opt for anti-VEGF monotherapy. So the answer to the better outcomes within the combination therapy should lie within the choroid. So our study aimed to elucidate the reason for the same. So the study compared the effect of the combination therapy and anti-VEGF monotherapy on choroidal vascularity indices and morphological parameters in PCV. It was a retrospective observational analysis done in 33 eyes with PCV with a visible sclerochoroidal boundary on EDI. So the combination therapy arm with 17 eyes, they underwent full fluence photodynamic therapy with 3 loading doses of anti-VEGF. And whereas 16 eyes in the monotherapy arm underwent 3 loading doses of anti-VEGF. And from the 3rd to 6th month, it will be PRN regime followed. EDI at the foveal section was used for choroidal imaging, and using ImageJ software, the binarization and computation of the vascularity indices was done. So to avoid bias, we included cases with polypoidal lesions within 3 disc diopter area of the fovea in both the groups in such a way that the greatest linear dimension circle in the PDT involved the fovea. So ImageJ, through a series of processes, it binarizes the total choroidal surface area into luminal area and the stromal area. The luminal area will be shown as black and the stromal area will be shown as yellow. So the vascularity index will be the proportion of the luminal area to the total choroidal surface area. So we studied the visual acuity, the PED DLS morphology, the total choroidal surface area, luminal and the stromal area, the vascularity index and the disease regression and the recurrence. So coming to the results, both the groups received 3 anti-VEGF injections in the first 3 months. And from 3rd to 6th month, as it was PRM regime, combination arm received an average of 1.25 injections and monotherapy received an average of 2.5 injections. At the end of the 3rd month, 77% of the eyes in the combination arm was inactive and almost 35% remained inactive in the anti-VEGF monotherapy arm. At the end of 6 months, almost 67% remained inactive in the combination arm, whereas only 41% remained inactive in the monotherapy arm. That means that even at 3rd and the 6th month, 50% of the eyes still had disease activity in the monotherapy arm. There was a statistically significant improvement in the best corrected visual acuity at 3rd and 6th month in the combination therapy arm, while it was achieved only at the 6th month in the monotherapy arm. And the morphological alteration of the PED, it was statistically significant only in the combination therapy arm. The double layer sign, which is considered to be the encroaching branching vascular network, the width was continuously decreasing from the 3rd to the 6th month in the combination therapy arm, while it was increasing in the monotherapy arm. And the choroidal thickness also, it was decreasing in the combination therapy arm, while it was increasing in the monotherapy arm. So to your right is an eye treated with the photodynamic therapy. You can see there is a complete collapse of the extra large PED with the resolution of the subretinal hyperreflectivity, where in the left it is the monotherapy arm treated eye. There is only partial collapse of the PED with the resolution of the subretinal hyper. So with this, there is better outer retinal remodeling with the combination therapy. So at the 3rd and 6th month, combination therapy arm showed a statistically significant decrease in total choroidal surface area, luminal area and stromal area, whereas in the monotherapy arm, only total luminal area decreased, that too at the 6th month. While the CVI, which was a proportion of the luminal area to the choroidal surface area, it doesn't show a statistical significant reduction, even though both it was decreased. So it also showed that better choroidal vascular remodeling also occurred with combination therapy. So the PDT causes short-term choriocapillary hyperperfusion and long-term choroidal remodeling. These all facts are supported by our results in combination arm in view of statistically significant reduction in the total surface area as well as the total luminal area. But anti-VEGF also caused reduction in the luminal area at the end of 6th month. So it is logical to assume that either the number of vessels or the diameter of the vessels have reduced. So the VEGF can dilate vascular channels by upregulating nitric oxide synthase dependent pathway. So the downregulation of VEGF can cause an additional decrease in the total luminal area. So our study in view of better retinal and choroidal morphological changes and vascular remodeling strongly support the superiority of combination therapy over anti-VEGF monotherapy in PCV. So the choroidal vascular parameters could be a useful tool to understand the effect of therapeutic intervention. Being primarily a type 1 choroidal neovascularization, the administration of the intravitreal anti-VEGF should benefit in PCV, but it can resist the growth of the same. But PDT addresses the choroid, the origin and the root cause of the disease activity in PCV, and hence less recurrence rate. Thank you.